What to expect during the second trimester of your pregnancy. Your body. Your body will undergo physical changes during your second trimester, as your baby grows from the size of a lima bean to weighing nearly 2 pounds. You may experience some standard pregnancy aches and pains. Almost all of these changes are temporary and will disappear once the baby is born. Keep up with your prenatal visit schedule and call the obstetrician if any symptoms seems to be a significant problem for you. Backache. As you gain weight over these next few months, it puts pressure on your back and changes your posture. Sleep on your side with a pillow between your legs to try and ease some of the strain on your pelvis. Use chairs that provide good back support and remember to sit up straight. Now is the time to stop carrying heavy things or picking up heavy items. High-heeled shoes are also going to aggravate a backache. Dizziness. Your circulation changes when you become pregnant because you have more blood volume and you are supporting a baby inside you. These changes can cause you to be dizzy, especially if you stand up or change positions too fast. If this is a problem for you, make sure you are drinking enough fluid. Try to change positions more slowly, and do not stand up quickly. Do not stay on your feet for long periods of time if you are having problems feeling dizzy. If you do start to feel dizzy, lie down on your sides until the feeling passes. Expanding belly and breasts. Your uterus has to grow to make room for your rapidly growing baby. As it grows, your belly expands, too. Your breasts also continue to grow. You need a bra that gives good support. Wide shoulder straps will feel far more comfortable. You may also feel some discomfort or aches in your abdomen as it grows in the uterus and its supporting ligaments stretch. This is normal. Heartburn and intestinal problems. Your body makes more of the hormone progesterone during pregnancy. It relaxes muscles, including a ring of muscle in your esophagus that keeps acids and food in your stomach. It also relaxes the muscles that move food through your intestines, causing constipation. You may find relief by eating smaller, more frequent meals and avoiding foods that are greasy, spicy or acidic, such as citrus fruits. If constipation is a problem, eat more fiber and drink extra fluids, plus try some gentle exercise like walking to keep your bowels moving regularly. Hemorrhoids. Hemorrhoids are a kind of varicose vein that form around the anus. Thanks to the extra blood in your body and the pressure of your growing uterus during pregnancy, these veins may become swollen, painful and discolored. Sitting in a warm tub or a sitz bath may help relieve the itching and pain from hemorrhoids. Ask your doctor if it is safe for you to use over-the-counter hemorrhoid creams or ointments. Leg cramps. As your pregnancy progresses, leg cramps become more common. They often occur at night. Help prevent them by staying active and drinking plenty of fluid. Do calf stretches before bedtime. If you get a leg cramp, stretch the calf muscle gently. Sometimes warm showers or baths, muscle massage or ice massage on the cramped muscle helps relieve the pain. Sexuality. You may feel more amorous during your second trimester. In part, this is because you feel better all over now that morning sickness has passed, and partly because you are making estrogen at an incredible rate. A pregnant woman's ovaries make as much estrogen in one day as they will in 3 years when she is not pregnant. Shortness of breath. You may feel out of breath as you progress through your pregnancy. Your uterus is growing and starting to crowd your lungs. Even mild activity like walking might seem more difficult. If you find this becoming a severe problem, talk to the doctor. Skin changes. Your hormone changes during pregnancy can trigger changes in the melanin, or pigment cells, in your skin. Some people may see brown patches on their face, called melasma, or a dark line down their abdomen called linea nigra. These changes are common, and they usually fade after the baby is born. They are aggravated by sun exposure, so use a good sunscreen. Stretch marks. Sometime during your second trimester of pregnancy, you may start to notice reddish lines forming along your abdomen, buttocks, thighs or breasts as these areas grow larger. Stretch marks cannot be prevented by moisturizing the skin. However, most stretch marks eventually fade after your baby is born. As you lose your pregnancy weight, they should become nearly invisible or show as silver or white streaks. Urinary tract infections. Pregnant women are more susceptible to bladder infections. Call your doctor if it hurts when you urinate, or if you have a fever and backache. Without prompt treatment, a urinary tract infection can get worse or even become a kidney infection. Vaginal discharge. It is normal for pregnant women to have a clear or white and slightly sticky vaginal discharge. If there is an unusual color or strong smell, or if you have pain, soreness or itching in your vaginal area, contact the doctor because this may be an indication of an infection. Weight gain. Once your morning sickness ends and your appetite returns in your second trimester, you should begin to gain weight. Your doctor will guide you on much weight you should gain during your pregnancy. You do not need to stuff yourself with extra food, however. An extra 300 to 500 calories of healthy food per day during your second trimester should put you on track to gain the recommended 1/2 to 1 pound per week during this time.